let's start with the bowl. When you make your own sensory bowl at home, you want to start with maybe rice. So try that. That's pretty simple in the beginning. And the object of this bowl is to try to identify the different sensations. So in other words, I want you to stick your hand in. I want you to think about the temperature inside. I want you to determine if you can actually feel the grains within the bowl. Within that bowl, you want to add small objects such as pins or feathers or hair beads and things like that. And you can buy some of the objects online, in fact. I love water beads. They feel absolutely wonderful. They're nice and cool. We have you guys to stick your hand inside. They're easy to clean off. After every patient, we spray them down. We put some form of alcohol solution inside. But they feel wet, they feel cool, they're soft, and they're perfect for someone who have actually numbness or tingling. It feels very soothing to the hands and the feet. It does, yeah. I always advise people to use a toothbrush and just brush along whatever area you're feeling that numbness. If you can tolerate something a little rougher, I want you to use that as well, okay? And you always want to use some kind of massage tool along something that has numbness. And it usually comes with different accessories. I like this flathead accessory because it allows for me to go along the digits smoothly. There's a couple more in there that are more pointier, so you have a light vibration on the hand. All right, so that's a mini vibrator. We talked about the brushing. Another thing that we do a lot in therapy, we do a mild cupping. Cupping has gotten really popular with athletes as well. If you have tightness in the muscles, you generally want to loosen your hand up with some light cupping before you start sensory re-education. So with that being said, we may lotion the hand, put some ultrasound gel or some massage gel on the hand, and then we'll use some small cupping devices to pull the skin up prior to doing any sensory re-education, okay? You can also get these cupping tools online as well. So you want to use hot whenever you have hyper sensation to calm the nerve. So that's if you're feeling tingling, numbness, you want to use something that's warm and soothing. But if you have numbness, you want to use maybe cold sensations on that. So there's different tools you can use. You can make things at home, like a freeze and ice cup. And I would suggest using a styrofoam ice cup that you can peel away and then use that on your hands or feet for stimulating the nerve. So you can use an ice cup. This is an ice stick. You just simply put this in the freezer, and then once it comes out, you just go along the hands, the fingers that are numb. So this is called an ice stick. This is just an ice ball. We put this in the freezer and it rolls along the skin. So this is really nice to have too. It's important that you do things like lotion your hands to try to get a stimulation that way. And we all lotion our hands and our feet anyway. So you want to add some kind of pressure when you do it and try to do individual fingers and individual toes. And just try to get that blood flowing and try to re-educate your nerves. Then Dr. Teal, Epsom salt. A lot of my patients that have neuropathy, they tell me all the time that Epsom salt helps with tingling in the feet, okay, and in the hand. I like to use BioFreeze as well. BioFreeze has menthol in it, and it's a great way to stimulate those sensory nerves as well. So BioFreeze is used quite often in clinics and hospital settings.